नमस्कार मेरे प्यारे दोस्तों. I welcome you all. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, would like to welcome you all in my Ayurveda Academy YouTube channel. My dear friends, you know very well that I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. For paid online consultation, yes, I have the team of the doctors. So you can definitely only WhatsApp me on 922681060. The number is given in the description. My dear friends, today we will see how to examine the patient who is having the complaint of fever with chill. We will try to see how we should go for the examination of the patient fever with chill. Actually, chill is like a shivering. So little chill is very common in each and every fever. But here I am talking about fever with severe chill or fever with rigor. We are talking fever with rigor. There is a high temperature and also there is a lot of shivering with the patient. So let us start to discuss. The patient has come to me, the patient has come to any doctor, and patient is complaining, "Doctor, I am having the fever with lot of rigors since last 4 days." So doctor immediately starts thinking, "Oh, fever with rigor. So is it a case of malaria?" Because the first impression, fever with rigor, the primary diagnosis is, yes, malaria. But then I have to confirm it. So I start asking the questions to the patient. "Hey, guy, does this particular fever comes every day or on alternate days?" The patient answer, "On alternate days, sir." Then I ask, "Does it come at the same time every day?" That means alternate day. Yes, doctor, it is near about every day when the fever comes. It is around 3 to 3:30, but the time is little bit fixed. So I am little bit get confirming about the malaria because periodicity is there. Then I ask him, the patient, "Do you have the headache with the fever?" Patient is answering, "Yes, doctor, I get the headache when there is a fever." So doctor is thinking, "Oh, this is probably the case of malaria." But I must rule out the other two conditions which can cause fever with rigor. The first suspicious diagnosis is definitely malaria. But what are the other possibilities? So I must check it out with the patient. The doctor is asking the patient, "Do you get any burning urination or the micturition? When you pass the urine, is there any burning or pain?" No, doctor, no, I don't have any urinary problems." Oh, that's better. That means in my mind, the doctor is thinking that I have ruled out the possibility of urinary tract infection, because UTI, urinary infection, is another important cause for fever with rigor. Still, I have one more diagnosis in my mind. So I ask the patient, "Hey guy, do you have painful swelling anywhere in your body, especially in your or your buttocks or in the loin? Do you have a painful swelling?" Of course, I have in my mind that it may be abscess. So pus and abscess also can cause fever with rigor. But again, fortunately enough, the patient is saying, "No, doctor, I don't have any pulse or any painful swelling in any of my body part, that is like what you can say, the buttocks or the loin. No, I don't have any such problem. Okay, okay. Then come forward. That means we will check you up. Then the doctor will check the sclera. Can you see the sclera? The white portion of the eye. The doctor will check the sclera. Is there any icterus? Because yellow colored sclera is indicating infective hepatitis or jaundice. But of course, in my mind, I have made a provisional diagnosis that this is the case of malaria. But I should check all other important things in the body. Then I ask the patient to say, ah. So I will take the torch, put it in the throat, and I will see, is there any inflammation in the throat? That means, is it there pharyngitis or something like that? But when I say ah, I will observe the tongue, especially for the pale color, because pale color tongue is definitely indicating that the patient is having anemia, and I can ask for the hemoglobin estimation. Yes, normal hemoglobin is 12 to 14 gram %. Then I will also check here the neck and the cervical part. This neck examination is for palpating the lymph glands. Lymphadenopathy is very important because lymph glands can be enlarged or lymphadenopathy may be present because of 2 or 3 important reasons. One is the local area, any infection that can create the lymphadenopathy. Second, if there is a cancer, especially in the ladies, breast cancer, then axillary lymph nodes may be palpable. If the patient is suffering from pulmonary tuberculosis, then cervical lymph glands will be enlarged, but they will be fused. That is called as a matting, M-A-T-T-I-N-G, matting of the cervical glands. That is a main important feature of the tuberculosis. Okay, then I am asking the patient to lie down on my examination table, and I would like to check the abdominal parts. So I ask the patient to take the folded knees and take the legs toward the abdomen, because to make the abdominal muscle relaxed. And then I will try to see the liver and spleen palpation. Liver is on the right side and spleen is on the left side. But I'm having provisional diagnosis as malaria. So I am more interested to check the spleen, because in malaria, splenomegaly is very, very common. Yes. I find there is a splenomegaly. So my provisional diagnosis is definitely correct, that is malaria. Then I will go further and try to check the chest, especially the respiratory sounds and the heart sounds. And in the respiratory sounds, I will also like to check whether there are any RAS or crepitations or the pleural rub. So RAS, weight sounds are possible in the pneumonia. So I have to check and rule out the pneumonia possibility. Oh no, there is, everything is normal. Pleural rub is common in the pleurisy. Okay. Then I will go further for my checkup, and I will try to see the inguinal region in the male, especially inguinal lymph nodes. And I will also check for the edema of the legs. Why? Yes, you must know that edema of the legs, specifically in particular part of the India, can indicate filariasis or elephantiasis, or inguinal lymph node can be palpable if there is an infection focus around the buttocks or around the legs. So I have to confirm each and everything, and then I will make the diagnosis. Yes, this can be the case of malaria, provisional clinical diagnosis. So once again, as a short summary, key points, which are the very important points in the case of fever with Rigor. Number 1, periodicity of the fever. Here the patient is saying there is alternate day fever and specific timing is around 3 to 3:30. Then there is a headache. Then I found that there was a splenomegaly. Then I ruled out that there is no burning micturition, no urinary tract infection. Then I have seen that there is no filarial edema. I have checked that there is no abscess in the body. So moreover, I confirm with my diagnosis, provisional clinical diagnosis, malaria. Naturally, the doctor will give the anti-malarial treatment, especially everybody knows chloroquine, that is tablet risocin and also followed by the tablet primaquine. My dear friends, just wait. I have already uploaded the detailed video about malaria causes, malaria symptoms and malaria treatment. So you can just follow that particular, the link. I am giving the link also as a, the table over there. That means you can check it out with the link. Okay. Then I would like to tell you that we have to give Ayurvedic supportive medicines also. Like for example, in Ayurveda, Parijataka Guti, 2 tablets 3 times in a day is very good for the malaria case. Then I can also give some symptomatic treatment for the headache, etc. But simultaneously, I will refer the patient to the pathologist and I will advise to the pathologist, please check the CBC, complete blood count, especially hemoglobin also I am interested, hemogram and ESR. So hemoglobin give you the idea about anemia. WBC can count malaria. It is naturally the leukopenia side of treatment, leukopenia side of finding. Then eosinophil count, I will ask, it may be to just counter check if there is any eosinophilia, etc. Then most important investigation is peripheral blood smear. Peripheral blood smear to check the malarial parasite under microscope. Then I will also support my, the diagnosis with another documents like urine routine, because as the patient is saying there is no problem in the urine, but I want to confirm it. So urine routine examination will show absolutely normal. No albumin, no sugar, no bile salt, bile pigment, no pus cells and no RBCs. Okay. So these investigations I need to confirm my diagnosis. By chance, if any patient, the urine is showing pus cell, it indicates urinary tract infection. And then I will have to go further to check the excretory system or the renal system. For example, if urine is infected, then I will ask ultrasonography, that USG abdomen, to see the size and shape of the kidney. Then I also can ask the kidney function test or renal function test, that is serum urea and serum creatinine, to just confirm the excretory system is working well or what are their problems. So my dear friends, today I have presented in front of you the case of malaria and how to examine, which things to be examined when the patient comes to you fever with rigor. I hope you are liking this type of the videos, and I will take one by another specific symptom complaint of the patient and will guide you how to examine that particular patient with that particular complaint. So please like and share this video, and do not forget to subscribe my YouTube channel to get the notification of further interesting videos. I wish all the best. Take care and see you soon. Thank you very much.